Today we're going to have an interview on actually why you are anxious and how you can finally find inner peace. My guest today is Dr. Ladislav Timolak. He's a professor in counseling psychology at Trinity College in Dublin in Ireland. Ladislav is involved in various psychotherapy trainings in Ireland and internationally. He's particularly interested in the development of emotion-focused therapy and has written or co-written 10 books and maintains a part-time private practice.
Sorry, thanks for having me, Ghazaleh. It's great to be invited.
Absolutely. Thank you for taking the time because, anxiety disorders are among the most common mental health conditions worldwide. And according to data from various global health organizations, the prevalence of anxiety disorders can be significant. For example, the World Health Organization estimates that around 264 million people worldwide suffer from anxiety disorders. Especially general anxiety disorder is a complex condition characterized by excessive, uncontrollable worrying and overthinking. It comes along with a range of physical, behavior, and emotional symptoms. These anxiety symptoms often significantly diminish quality of life across relationships, work, and health domains. We know, meanwhile, that understanding how anxiety interacts with our emotions is crucial in our healing. So can you help us to understand how are complex childhood trauma and traumatic experiences actually connected to anxiety?
Hey, so, anxiety, first of all, any kind of difficulties in the area of mental health may be complex, yes, and we may undergo adverse experiences, whether it's in childhood or later on in life, and they'll impact us. They contribute to developing vulnerabilities for similar type of experiences, or they may have long-lasting impact. But whether somebody will develop particularly anxiety as opposed to depression, or as opposed to like PTSD used to be coupled with anxiety. Now it's seen as a little bit distinct, or some other difficulties. We don't know that much about it. Yeah? So there is clear link between experience of adverse experiences, adverse situations, events, and long-lasting impact. But whether it'll be anxiety, it's a little bit tricky, and we are, still studying. Yes, like how come that this happened to me and this similar thing happened to you, but I developed this, you didn't develop anything, or I developed anxiety and somebody developed depression. So it is a little bit more complex, I would say.
Yeah, absolutely.
So
But
that's one thing, but I'll just finish on that. But in anxiety specifically, you are basically scarred by something that happened and you don't want it to happen again. And therefore you are preparing for possibility of something that you don't want to happen could happen again. And you are doing it by kind of either trying to avoid situations that could potentially bring something painful or unpleasant, or you are preparing for them or over preparing for them. Like worry is a mental process that is like a feature of anxiety difficulties, and it's basically going over scenarios, what could happen, and in order to be better prepared if these things happened. Yet while we are engaging in that process, it already makes us somewhat aware that this may happen, and it makes us anxious already as well. Anyway, so that's like a kind of basic kind of feature of anxiety.
yeah, as if like I have to make sure that I control my environment, the future, the world, and that's what makes me feel safe in the world then, or at least in my sense, in my experience.
Definitely, definitely. So for instance, the easiest example is often, you mentioned generalized anxiety, but actually social anxiety is the most prevalent of the anxiety disorders. And in social anxiety, many people have difficulty of speaking publicly, or don't like to be kind of exposed and take the central stage or something to be seen. We are actually afraid that we may be judged. So we actually anxiety is only signaling that there is a potential judgment coming, yes, that there's a threat of judgment. But the experience that we really don't want to have is experience of shame and humiliation, is that we are judged negatively, or not as good, or not as clever, or not as I don't know, attractive, smart, and so on. So we are anxious that we will be judged. We are kind of projecting scenarios. We are scanning environment, or we avoid any public speaking as well, just to make sure that we wouldn't experience shame. But actually, what we don't want to be experiencing is shame. Now, is it because we were shamed when, some adverse experiences happened before? Often it is the case, but many people are ashamed and or had experience of being publicly ridiculed, or by peers, or invalidated by caregivers or so. And not everybody develops social anxiety. This is what I'm just saying, that it's complicated.
Yeah, yeah. But this is actually very interesting because we often hear that anxiety is a placeholder emotion.
Yeah, yeah.
Help us to explain what that actually means. You just mentioned, shame, and then we get anxious, but underneath that, actually, we feel like maybe a shame. Can you help
Yes.
me what it means when people say anxiety is a placeholder emotion?
Yeah, I think that's a good way to put it. So, like in social anxiety, that would be an example, is that we are anxious that there will be judgment, but what would be so unpleasant would be shame, yes? If we had something traumatic in terms of like post-traumatic stress disorder used to be classified in the same cluster as a form of one of the anxiety disorders. And in PTSD, we have experience where our life was threatened or health was threatened, and we experience fear, and that there is this, or physical pain, or something, yes, and we don't want this to happen again. So anxiety is actually a response to the potential threat of being physically assaulted, but it's the underlying fear, or physical pain that we don't want to feel if this happened again. So we are avoiding situations where original kind of, or similar situations where the assault happened, and so on. In generalized anxiety, there may be various things that may be responsible. I mean, that may be at the core or underlying emotions. It may be sense of responsibility, is that I'm a caregiver, caretaker of somebody, and I let down my children, for instance. Yes, I wouldn't be able to live with the guilt and shame of letting them down, letting them unprotected, and so on. So I overprotect them, yes, and I worry what could happen to them, and try to follow on. Worry is a mental process, but then I control, yes, I extend control and become an overprotective parent, over involved, and managing, micromanaging others. But actually, I wouldn't be able to live with the guilt if something happened, yes?
Right. So anxiety often also covers underlying painful feelings of guilt and shame. Right. Okay. So, what are the major steps of healing anxiety from an emotion-focused perspective?
Of healing it, you're saying, yes? So first of all, like, how come that somebody develops anxiety as opposed to anxiety disorder classifiable according to clinical criteria, which usually suggests that it somehow impairs everyday functioning? Because anxiety is like any emotion, is adaptive emotion, is, I mean, it's reasonable to be anxious to go in the dark alley. Will somebody jump me? So it's quite reasonable to take precautions, or I have a public lecture. It's reasonable to prepare. Yes, that how will I get my message across? Can it be criticized because I didn't prepare, or it's not correct what I'm saying? So anxiety is totally adaptive thing. The issue is that people who suffer from anxiety difficulties, to the extent that it causes difficulties in their everyday functioning life, they can sleep, or they have physiological symptoms of anxiety that are too much and unpleasant, or they're not flying, as anxious flyers are limited, that they don't travel, and so on. So it usually indicates that, I think, why it happens. I mean, we don't really know, but it may well be that the role can be also our kind of biological makeup as well, because people respond differently and to even painful and unpleasant emotions. For some people are emotional experiences that are kind of painful, very aversive, very even physiologically distressing more than others, and it's harder for them to get back to kind of more relaxed or kind of homeostasis in a way that I'm feeling fine, and therefore it's more likely that I will not want to feel it again. Yes, what happened to me. So I think it's complex. I'm not saying that usually, I'm not usually you have some adverse experiences, but some adverse experiences you don't want to have. So you are over preparing not to have having them, or are avoiding situations that could have them, and that will lead to the development of anxiety difficulties. Now, when you are very anxiously oriented, first thing, obviously, that the core, and that's the EFT motion focused therapy, that it's somehow in the background of this podcast or YouTube video, if I understand, is trying to heal the underlying vulnerability. Yes, it's shame, guilt, or fear, yes, of the assault, and can make me more emotionally resilient. So that's the underlying goal in therapy, to make me more kind of stronger, that I'll be able bounce back if something happened, or that I'm more self-acceptance so I won't feel that guilty, or self-acceptance so I won't feel that humiliated, or that I feel I take pride in my accomplishments and therefore the shaming is not that defining of me, and so on. So that's the ultimate goal. But when somebody is very anxious, people may not have capacity to go to underlying vulnerability that somehow is at the root of that anxiety. So we have to deal with anxiety itself.
As the cycle of the worrying and overthinking is so strong,
Yes,
power of
yes.
life, that
Difficult to break in. It's difficult to break in through, if I'm anxiously oriented, and even though it is because I have some vulnerability that made me kind of so anxiously oriented, it's very difficult to break through that anxiety orientation. So we need to kind of make it a little bit smaller initially. And obviously, traditionally, this was done through relaxation exercises and so on. Explanation, like as we do now, like what's actually happening in anxiety. It's very important that people understand. But and I think it's good to build a capacity that people do understand and are able even to get some physiological relief from feeling anxious. That's very important. Yes, and there are a lot of things that may help. Uh, um, Talking, a particular type of talking, not just reassurance seeking, because reassurance seeking may not work, but talking that goes to kind of the biggest fears is good. I mean, physiological things, there are some psychological techniques, various forms of relaxation. Some are also used in the context of emotion focused therapy, like clearing a space where we are trying to put upsetting things aside for a moment, or having a presence of soothing other, that you bring in imagination or enact how they would be with you, and how would their calming presence look like. That may be quite soothing. Breathing exercises and so on. And when people do meditations and other things, so these are good initially to get some sense, some relief from anxiety. But essentially, then the work has to focus on what produces anxiety, and this is a preoccupation with potential threat. That's in the worry process. And to see that I actually want to protect myself, getting involved in it. But the cost is that it increases likelihood. I mean, in my judgment, it increases likelihood of that threat, or I mean, my sense is that it increases likelihood. Yeah. So if I'm anxious flyer and I start to look at all potential disaster or something, I actually will be more aware of threat constantly. Yes. And rather than being prepared, I will actually estimate the likelihood that something would happen much higher, because I'm aware of everything that can go badly. So we need to look at what's happening in the worry process. You want to protect yourself, but the impact it has, it keeps you anxious and tired, constantly engaged in the threat. So we are learning to have a balance and kind of put a boundary to the worry, to feel the cost of the worry and put a boundary to the worry, or trying to let go of the worry, seeing that this is the impact it has, yes, on me. That's a major work in EFT, yeah.
That's when you said earlier on to feel stronger about yourself, that you can set the boundary.
To the worry as well. So we try to highlight the function of the worry, awareness, how I worry myself, and then set a boundary to the worry, and kind of try not to go along with the constant focus on an orientation on a potential threat.
Yes.
That's all what I would refer to more symptom level work. But the core of the work will be then like, what are really the things that I wouldn't want to happen, and how they're connected in things that either happen to me in my life or matter to me in my life or are somehow relevant. Yes. Let's say if we said that social anxiety, do I have a worth? Yes. Or can I trust? Am I okay with myself? Yes. If I had experiences of shaming, can I kind of go through them in therapy? Yes. You are aware we are doing imaginary dialogues and stand up to, if we were put down by important people in our life or by peers who are not that important, or teachers, yes, or caregivers and so on, can we stand up to them? Can we have a sense that somebody's judgment can't define us, that we feel self-acceptant or proud of ourselves? Then we will be less scared going to a potential environment where we could be evaluated, yes, and judged, because we will not be that fearing that if the shame came, that it would be so defining of us. So that's the ultimate goal, yes, but that's not that much different from how emotion-focused therapy works, that we want to access vulnerability, articulate unmet, able to help the clients to tolerate the vulnerable feelings, painful feelings, articulate unmet needs in them. And so in shame, it's to be seen, valued, validated, accepted, and then generate experiences that heal that vulnerability. And these experiences have two pillars. One is more compassionate pillar, like self-acceptance, or having memories or of when people were appreciative or caring towards us. And the other one is more assertive boundary setting. I call it also protective anger, able to set a boundary to unfair kind of things that happen to us, like judgment, or in case of assault, it may be anger directed at the perpetrator of what happened. And it's a little bit more complicated because there's some other processes that may happen as well. Sometimes we need to grieve, some adverse experiences that are linked to anxiety, maybe losses, or it may be even grieving what we endured when bad things happen to us. That often also kind of follows, particularly from more kind of compassionate like experiences in therapy. So we are trying to heal that vulnerability that anxiety tries to prevent it to be activated. Yeah? So we are healing both. I mean, we are trying to kind of get anxiety to more adaptive level rather than just being so kind of overwhelming and defining and constantly present. And then we are trying to heal the vulnerabilities. We always stay vulnerable. I mean, we are vulnerable. The life is difficult, but we want to kind of equip people to be somewhat more internally resilient to the extent that it's possible. Yes, it's important to be acceptant as well. Yes, we are even biologically or physiologically different, yes, and some people will have stronger reactions than others, yes, and they are more likely to develop a particular type of difficulties versus other people, So
To break it down, the first step is finding ways to soothe myself on that anxiety first, whether if it's relaxation techniques,
I would say so, yeah, I would say so.
breathing techniques.
Yeah.
And it's about working actually with that worry part of me that makes me worry, and find more assertiveness and in myself, so I can set boundaries towards the worry.
Yeah, or trying to let go of worrying. So yes, it's like to see how I actually contribute to my anxiety, yes,
Agency in myself.
by overprotecting myself or by avoiding things. Yes, often worry then leads to me not doing certain things, like not flying or not having public speaking,
and the impact of that for my life, right?
or overprotecting my close ones, yes, in GAD often as well. Yes, so that worry is followed by actions in real life, and it's usually control or avoidance as well. Yeah.
And once I did the symptom work, then I actually can work with what's underneath the anxiety, that emotion, that painful emotion that I try to avoid feeling. You mentioned
Exactly.
of shame in case of social anxiety.
I
And
mean, it's usually like in any like in any kind of I won't, I'm trying to avoid the word psychopathology, but things that are vulnerable are experiences of profound sadness, loneliness, loss, shame, and fear. These are like three clusters: one around sadness, one around shame, and one around fear. These are the experiences. They're too much.
yeah,
We may not want to have them again or something. Yes.
actually learning ways to be vulnerable and tolerate those feelings, and then finding whether that self-compassion for myself, the self-acceptance for myself that can be soothing, and or creating more healthy adaptive anger, protective anger, so I could feel stronger about myself in the world, maybe towards the abuser, to also express that suppressed anger that maybe is underneath the anxiety that leaves me feeling weak and anxious in the world, right?
Yeah, I would concur with that. Yes. I mean, there's one thing that I want to mention is because the current kind of dominant model in psychological therapies, cognitive behavioral, kind of focuses on exposure. So it is compatible with what we are discussing here in terms of, let's say, in case of social anxiety, that there is the ultimately that I won't avoid, yes, and then I'll have experiences of successes in public speaking, let's say, and the focus on the threat that I'll be judged negatively will diminish, and I'll trust that I can get through it. So that's actually compatible with EFT. But what we do in EFT, we don't want just the person to kind of touch on their underlying vulnerability and expose themselves. The painful feelings indicate that there are some unmet needs in them. Yes, in loss and loneliness, it's a sense of connection or need for connection. In shame, it's need for acceptance, validation, being seen. In fear, it's more a need around protection and safety and so on. So we actually are trying to get to vulnerable feelings, to articulate the needs, and then generate experiences that respond to the needs. So it's true that, you know, if I eventually kind of speak publicly or whatever, that I'm also kind of building myself. But we want person first to see that shame won't define me. I can feel also kind of accepting of myself or proud of myself, and or I can feel for myself how difficult it is in shame. Yes, that's more compassionate sense. And then I don't want to have my life limited, and that's why I will kind of go and will not limit myself, and will go and eventually will have, let's say, will engage in public speaking and so on. So it's not incompatible with a prevailing kind of model of mental health kind of treatments that are there, psychological therapies that are there, but it's a little bit more complex than just do it anyway or something if you're scared. Yes.
Yeah. But Vladislav, can you give us one important advice for someone who's starting this journey to work on their anxiety? If you could give them one important advice, what would that be?
So I think that it will be two advices. Yes, one is difficult. I mean, it's people want one advice on everything, but therapy is 11 and 55 other things, you know, or whatever. But I think there are two things. First, if you are very anxious and that's unbearable, I think you first need to get to a place where you have some break from it.
Mhm.
Because when you are very anxious, it's very difficult to do anything. Yeah? So that's one thing. To get it to a place that it's not so present, and that's more around finding something relaxing, calming, soothing, and so on. And then when you are in a better place, try to see what's at the core, what I really don't want to feel when I'm anxious. Yes. And try to heal that. Yes. And to see how can I build myself that vulnerability will not be so scary that my whole life will be kind of circulating around, avoiding it or preparing for if it got triggered, is to heal my vulnerability. And that's a complicated process, but we outlined. Yes, it's two. Yes, first, if you're too anxious, nothing will help, just to relax a little bit, find a way to have a break. And second, then heal what's the vulnerability. Yeah.
Myself, how can I, kind of calm down the anxiety a little bit? And the second question is, what am I avoiding feeling?
Exactly. And then heal that vulnerability, and that may be more complex process. Yes. So next time I don't have to be that oriented. Will something happen that will trigger it in me? Yeah.
Thank you so much for this insightful conversation about anxiety and what anxiety actually means and the major steps we need to take in order to heal Ladislav. Thank you for your time, and I hope to talk to you again. Bye-bye.
Okay. Thank you, Ghazaleh, for inviting me. It was great to talk to you.
Bye-bye.